Hello, I am Dr. Hema from the Department of Anatomy. Today we shall deal with the topic on parotid gland. Parotid gland, we will concentrate on the presenting parts and the relations. So we shall be dealing with parotid gland under the following competencies. It is about AN 28.9, which describes and demonstrates the parts including the borders and the surfaces. We will deal with the contents that are the deep contents of the parotid gland and its relations. So the student learning objectives include knowing about the capsule or the coverings of the parotid gland. We have to know the presenting parts, the structures that are passing through it, and the important relations. So here we will deal with parotid gland under the following headings: about the introduction, a brief introduction about the parotid gland. Then we will go into the coverings, that is the capsules, the presenting parts, then the relations, the focus on the processes and the structures passing through it, and finally we will wind up with applied anatomy. So here, what is a parotid gland? We know that we have three main paired salivary glands, of which the largest is the parotid gland. The largest of the paired salivary gland is the parotid gland, the others being the submandibular gland and the sublingual gland. So where is it located? It is situated in a region that is called the parotid region, which we have dealt with earlier, and this parotid gland weighs about 25 grams. And the shape of the parotid gland is in the form of an inverted pyramid. We can see that it is in the form of an inverted pyramid, and even though the parotid gland, we say it is in the parotid region, it extends beyond the mold of the parotid region, and it presents a few structures which are called as the parotid processes. So what are the coverings? What are the coverings of the parotid gland? Like any gland, the parotid gland also has a true capsule and a false capsule. True capsule is always formed by the condensation of the stroma. Condensation of the connective tissue of the gland itself forms a true capsule. But what forms a false capsule? So we have heard about the investing layer of deep fascia. So how does the investing layer of deep fascia enter into the face? Usually the investing layer of deep fascia stops at the level of the mandible, but posteriorly, from the angle of the mandible, the investing layer of deep fascia splits into two: a superficial lamella and a deep lamella. So this superficial lamella is what is forming the false capsule. So what is this false capsule called? If you look at this diagram, here, what you can see here outside, this is the skin. Deep to the skin is the subcutaneous tissue or the superficial fascia. Here there is a small muscle that is called the platysma, which is close to the superficial fascia or which is in the superficial fascia. Now just deep to that, what you see here in blue, this is the superficial lamella of the investing layer of deep cervical fascia. And here this is the masseter and this is the parotid gland. So we can see that this superficial lamella is covering the masseter and it is covering the parotid gland, and finally it gets attached to the zygomatic arch. So here that is called the parotidomasseteric fascia. The superficial lamella of the investing layer of deep cervical fascia covers the masseter and the parotid gland and gets attached to the zygomatic arch. Hence this false capsule is a tough fascia called the parotidomasseteric fascia. The presenting parts. Presenting parts we said that it is in the shape of an inverted pyramid. So here what we have towards the cervical region, this region is the apex, this above is the base, and then we have three surfaces and three borders. So if we say that this is the parotid gland, okay, if this is a parotid gland, here we have what is called the superficial surface, and that is the superficial surface that we are seeing here. This is the superficial surface, or it is also called the lateral surface. So then here will be the medial surface. Medial surface is further divided into an anterior medial surface and a posterior medial surface. So the three surfaces of the parotid gland includes the superficial or the lateral surface, anterior medial surface and the posterior medial surface. Here we can see that this is the apex. Here above we have the base, and this what you are seeing in red is the superficial surface. or the lateral surface. So this part what you are seeing here, this is the medial surface which is divided into an anterior medial surface and a posterior medial surface. Clear? So for these three surfaces to be formed, we have three borders also. We have an anterior border here, we have a posterior border here, and we have a medial border here. So the anterior border separates the superficial surface or the lateral surface from the anterior medial surface. Posterior border separates the superficial surface or the lateral surface from the posterior medial surface, and the medial border separates the anterior medial surface from the posterior medial surface. So that is how we have an apex which is directed downward, a base which is directed upward, and then we have three surfaces. One is a superficial surface or the lateral surface, anterior medial surface, and a posterior medial surface. And we have three borders. One is the anterior border, there's a posterior border, and a medial border. Before we go into the other relations, it is better to know about the deep structures or the deep relations, also called the structures that are passing through the parotid gland. There are three structures in different strata or different zones that are passing through the parotid gland. The most superficial structure is the facial nerve. So this is the facial nerve. Okay. Then in the intermediate zone, we have what we see in blue, that is the retromandibular vein. And the deepest strata, we have the external carotid artery. So in the superficial zone, we have the facial nerve. In the intermediate zone, we have the retromandibular vein, and the deepest zone, we have the external carotid artery. Now we have to see about each of these structures. First, we will see the most superficial structure, that is a facial nerve. This is the stylomastoid foramen. There is a foramen that is seen between the mastoid process and the styloid process, that is called the stylomastoid foramen, through which the facial nerve emerges from the cranial compartment. So this is the extracranial course of the facial nerve. Facial nerve, after entering from the stylomastoid foramen, enters the parotid gland through the posterior medial surface, and once inside the parotid gland, it divides into two main trunks. The trunk that is going upward towards the temporal region is called this one. This is called the temporofacial trunk, and that which is going towards the cervical region is called the cervicofacial trunk. The temporofacial trunk will divide into two further branches. One is that is the temporal branch and the zygomatic branch, and then the cervicofacial will divide into the buccal branch, the marginal mandibular branch, and the cervical branch. So we have 5 branches of facial nerve that is emerging from the parotid gland once the facial nerve divides into its two main trunks. So that is about the facial nerve dividing into two main trunks, and we have the 5 branches emerging outside, that is the temporal branch, then here we have the zygomatic branch, here we have the buccal branch, marginal mandibular branch, and the cervical branch of facial nerve. So when the facial nerve, the branches of the facial nerve emerges on the face out of the parotid gland, it appears like the webbed feet of the goose. So because of this appearance, because of the appearance of the webbed feet of the goose, the emerging parotid gland, the emerging facial nerve on the from the parotid gland on the face is called as pes anserinus, also called goose feet. In the intermediate strata, we have the retromandibular vein. So how is the retromandibular vein formed? There is a superficial temporal vein, this is the superficial temporal vein, joins with the maxillary vein, and they form the retromandibular vein within the substance of the gland. And within the substance of the gland itself, the retromandibular vein divides into an anterior division and a posterior division, and both these divisions will emerge emerge through the apex of the gland. We will just see what happens to these divisions also. The anterior division, once it emerges from through the apex, will join with the facial vein to form what is called the common facial vein, and that drains into the internal jugular vein. What happens to the posterior division? The posterior division joins with the posterior auricular vein to form the external jugular vein, which drains into the subclavian vein. So that is the formation and division of the retromandibular vein in the intermediate zone. In the deepest zone, we see the external carotid artery. So how is external carotid artery formed or from where does it arise? It arises as a branch of the common carotid artery. Common carotid artery at the level of the upper border of thyroid cartilage will divide into the internal carotid artery and the external carotid artery. So external carotid artery arises upwards. So what you see here in black is the border or the boundary of the parotid gland, and the external carotid artery is this. External carotid artery enters the parotid gland through the posterior medial surface. It goes up, and at the level of the temporomandibular joint, it divides into a superficial temporal artery and the maxillary artery. So this superficial temporal artery, which is emerging out through the base of the parotid gland, and the maxillary artery, they are the terminal divisions of the external carotid artery. So superficial temporal artery, how does it emerge? It emerges out of the gland through the base of the gland upward towards the temporal region, whereas the maxillary artery turns medially and goes inside. So these are the three contents or the deep relations of the parotid gland. We have the facial nerve, retromandibular vein, and the external carotid artery. Now let us talk about the relations which are related to the different presenting parts of the gland. First, let us see at the apex. At the apex, we can see that the cervical branch of facial nerve and the two divisions of the retromandibular vein. So the relations at the apex or the structures that are emerging through the apex are the cervical branch of the facial nerve and the anterior and posterior divisions of retromandibular vein. Coming to the base, this is the base. What are the structures which are emerging or related to the base? Here we can see the temporal branch. See, this is what is going here. This is the temporal branch of facial nerve and the superficial temporal vessels, and posterior to that we have a branch of the mandibular nerve that is called the auriculotemporal nerve. So these are the structures that are related to the base of the gland. We have the temporal branch of facial nerve, superficial temporal vessels, and behind that we have the auriculotemporal nerve. What are the superficial relations? Means what are the structures that are related to the superficial part of the gland? We had said earlier, this is the parotid gland. So here we have the skin, then there is a subcutaneous tissue, that is the superficial fascia, then we have the parotidomesenteric fascia. In addition to that, we also have the parotid lymph nodes, the superficial parotid lymph nodes, and the great auricular nerve, which is providing the cutaneous supply to the face, where at the angle of the mandible and in the region of the parotid gland. So these are the superficial relations. So what are the superficial relations? We have the skin, superficial fascia, then we have the parotidomesenteric fascia, a few lymph nodes called the parotid lymph nodes, and the greater auricular nerve emerging from the cervical plexus. What about the anterior medial surface? So in this diagram, which is the anterior medial surface? This is the skin, okay, this is the skin, so this should be the superficial surface. This is the pharynx, so this has to be the medial border. So this is the anterior medial surface. So the bone that is related to the anterior medial surface is the mandible. So here we have the ramus of the mandible, the two muscles attached to the ramus of the mandible, which are the masseter and the medial pterygoid. So we have the masseter, medial pterygoid, ramus of the mandible, and also part of the facial nerve and sometimes part of the maxillary artery also as it emerges. So these are the structures or important relations of the anterior medial surface. We have the masseter, medial pterygoid, both the muscles attached to the ramus of the mandible, part of the facial artery, posterior part of the temporomandibular joint, and also sometimes the maxillary artery and the facial nerve. Then, what are the relations of the posterior medial surface? For that, let us see which is the posterior medial surface. This is the superficial or the lateral surface. This is the medial surface. Here we have the mandible, so this should be the posterior medial surface. So this is the posterior medial surface, and we know that which process is related there? We have the mastoid process. The mastoid process is related to the posterior medial surface with the attachments. Which are they? We have the sternocleidomastoid and the posterior belly of digastric. Two muscles attached to the mastoid process are sternocleidomastoid and the posterior belly of digastric. In addition, we also have the styloid process and the muscles and ligaments attached to it. We have the stylohyoid, styloglossus, stylopharyngis muscles, and which are the two ligaments? Stylohyoid ligament and stylomandibular ligament. So, mastoid process and its attachments, styloid process and its attachments. Then here we have the stylomastoid foramen through which the facial nerve is emerging and entering into the parotid gland. Also, we have the relation of the external carotid artery in the posterior medial surface. We also have part of the carotid sheath. So, what are the posterior medial relations? We have mastoid process and the two muscles attached to it, that is the sternocleidomastoid and the posterior belly of digastric. We have another process, that is the styloid process and the muscles and ligaments attached to it. In addition, we also have the facial nerve emerging from the stylomastoid foramen, external carotid artery as it is before it enters into the parotid gland, and also part of the carotid sheath. These are the anterior relations, that is relations of the anterior border. What are the structures that are coming out of the anterior border? So, from above downwards, first we have the zygomatic branch of facial nerve. This is a zygomatic branch of facial nerve. Then we have an artery that is called the transverse facial artery, which is a branch of the superficial temporal artery. So, this is the transverse facial artery. Next we have the upper buccal branch of facial nerve, and below that we have the lower buccal branch of facial nerve. Between the upper buccal and the lower buccal, we will have the parotid duct or the Stenson's duct. Sometimes, if there is an accessory parotid gland, that will also be seen here in this region between the upper buccal and the lower buccal nerves. Then here we have the marginal mandibular nerve that is coming towards the angle of towards the lower border of the mandible. So, what are the structures emerging from the anterior border? First we have the zygomatic branch of facial nerve, then we have the transverse facial vessels, then we have the upper buccal nerve, then parotid duct, and sometimes the accessory parotid gland if present, lower buccal nerve, and the marginal mandibular nerve. So, these are the relations of the anterior border. So, what are the relations of the posterior border? This is the posterior border. Here we have the posterior auricular branch of facial nerve and the posterior auricular vein. So, this is the posterior auricular vein that is joining with the posterior division of retromandibular vein to form the external jugular vein we mentioned earlier. So, the two posterior relations are posterior auricular branch of facial nerve and the posterior auricular vein. Now, medial border. This is the medial border because here we are seeing the pharynx. So, medial border separates the anterior medial surface from the posterior medial surface. There is another name for the medial border, that is called the pharyngeal border. Why? Why do we call it as a pharyngeal border? Because it is close to the pharynx. Hence, it is also called the pharyngeal border. Now, as I said earlier, even though the parotid gland fits into the parotid region, which is forming a mold, some parts of the parotid gland extends beyond the mold, and these extensions are called processes. So, depending upon the region towards which these processes are growing, they are named. For example, we have what is called here the facial process. Part of the parotid gland grows out of the mold and goes towards the face, that is called the facial process. From the facial process, you can have another extra process coming out, that is called the accessory process. Another process of the parotid gland will go upward towards the temporomandibular joint, and that is known as the glenoid process. Then further, another process that is called the carotid process comes down towards the external carotid artery. We know that there is a plexus of veins called the pterygoid venous plexus, medial and lateral pterygoid muscles. All these are lying medial to or deep to the parotid gland. So, a process or extension of the parotid gland which goes into the depth or goes towards the medial pterygoid muscle, that is called the pterygoid processes. So how many processes did we say? One is the facial process coming towards the face, then another extra process from that is called the accessory process, a process going towards the glenoid cavity or the temporomandibular joint, that is called the glenoid process. That which is going towards the external carotid artery is called the carotid process. One that is going towards the medial pterygoid muscle is called the pterygoid process. In addition, there are two more processes which are related to the styloid process. What is seen in front of the styloid process is called the pre-styloid process of the parotid gland, and what is seen behind the styloid process is called the post-styloid process of the parotid gland. So these are all the processes which are emerging or arising from the parotid gland in various directions. Now coming to the applied anatomy, we are all familiar with a factor called mumps. What is mumps? Mumps is inflammation of the parotid gland. It is also called parotitis, which can either be due to a viral infection or maybe even a bacterial infection. Then another a clinical application is where we can see there is an infection of the parotid gland resulting in something called a parotid abscess, and we know abscess anywhere has to be drained. Then there is something called tumor. Tumors can be benign or malignant, and the mixed parotid tumor is very common. So these are the common applied anatomies related to what we have done now. There is another condition called Frey syndrome, which we will deal with later when we are talking about the nerve supply of the parotid gland. So to summarize, what did we do? We learned about the parotid gland. We did an introduction. We said what are the parts of the parotid gland, the surfaces and the borders. We spoke about the substances or the structures which are seen in the depth of the parotid gland, also called the deep relations of the parotid gland. And then we saw about the structures that are related to each of the presenting part of the parotid gland, and we spoke about the applied anatomy. So that summarizes today's topic. Thank you.